Every Monday, we bring you a case study of one of our patients, and we try to illustrate a story about what's happening with our patient and how you can use this information to help benefit your condition and also help you make better healthcare decisions about your spine. So today we're going to talk about why surgery is not always the right answer for back pain. We've talked a little about surgery, but this specific patient had both a laminectomy and a fusion, which is the double whammy. And he was in a lot of pain afterward. We call that failed back surgery syndrome. And one of the most common diagnoses for surgery, post-surgery, is failed back surgery syndrome. What does that mean? It means very often the surgery didn't do the intended result, which is eliminate your pain. We are the Illinois Back Institute, and we are here to help you. So this week the case was a 65-year-old male. This is case study number 874, and we're up to, I think, 1,100 now. 1,100, we're closing in on 1,200. 65-year-old male, he had back pain and sciatica. Sciatica is the pain down the leg, and he had back pain for 30 years. And sometimes this number right here tends to be the most important number. How long have you had the problem? Because how long you've had the problem also results in how much wear and tear you've had on your spine. There's some wear and tear that's normal, but there's also a lot of wear and tear that happens after you start to develop back pain. So the longer you have it, really the more problems you can have. So before he came in to see us, he tried physical therapy, and it's not uncommon. This is the course of care. He tried the cortisone injections. He was taking narcotics, and then he had the laminectomy. And the laminectomy, ultimately, when you have sciatica, is designed to take the bone off what is pinching the nerve, and then he had a fusion. Now, it's also not uncommon that you can have surgery on your spine, and they do these two at the same exact time. So they'll start and they'll open the back, and then they'll take the bone out, which is the laminectomy, and then they'll fuse everything together. And when they fuse everything together, very often that's when you start to have problems. So this is what the laminectomy looks like. Top view of the nerve, of the vertebrae right here, just like this. So this is the vertebral body, and inside is the spinal cord. And what they're going to do is they're going to cut off that back end of the bone right here. And when they cut out the back end of that bone, that's the laminectomy. And the goal is to free up the space. And when they free up the space, ideally they're supposed to free up that nerve, and then what they do is they fuse everything back in place. But the problem is it doesn't always work. This procedure, about a $50,000 procedure. This may be a $90,000 procedure. You're looking at about $130,000 for this type of procedure. Tends to be very, very, very effective. Why is this important? Effective, expensive. It's not very effective. Why is this important? This is important because, and what we do is we go through the literature and we read the literature and we say, in the literature, what is it saying about the effect of the surgery on the patient? So what do we find? One case, 82 patients, 35% said they had a good recovery. It means they felt better. Doesn't mean they felt 100% better, because I have that number on another slide, but they felt, 35% said, yeah, I feel a little bit better. 65% were no better off and or worse. And the worst thing you can have, obviously, is when it doesn't go away. Another study, what we found is there's a failure rate, and when I say there's a failure rate, just like here, when they were no better, that's technically a failure. Did the surgery, you're no better. And in his case, probably spent $150,000 on those procedures, no better off. 60%, one fusion, and what they'll do is they'll very often fuse multiple joints. So one fusion is two vertebrae together, which would be really what you're seeing here. This would be two vertebrae when you fuse those. But three-level fusions where they do three separate vertebrae up the spine like that. And what they do is they fuse it, and the more you fuse, the higher the failure rate. Okay? over 90% of the patients still have pain. About 10% say they have no more pain. So it's important that you understand what the outcomes of the surgery are. They're not very good. What they found, because the National Institute of Health did a study and say, why do so many fail? What they found is very often the doctor is going into the wrong area and they're not treating the problem where the pain is. They might be doing the vertebrae above or the vertebrae below. But also what happens when you have two vertebrae fused together is you ultimately increase the pressure on the disc. 24 vertebrae between the head and the hips. In between each vertebrae there is a disc. The disc allows for motion. Okay? But what happens when you overload the disc with a fusion, the disc above breaks down and the disc below breaks down. So not only are you dealing with an area that the surgery was not effective, now you're actually causing more problems. So what they found is very often going to the wrong space or they're actually treating the wrong condition. And these are some of the trends. This came out of a new study. There's an increase in the dependency on the narcotics, the highly addictive narcotics. As high as 90% of all the failed back surgery syndromes are taking more narcotics. So, and we talked about that number maybe being 65% that actually are no better. So after the surgery, they tend to get more addicted on the narcotics. They're taking more narcotics. An increase in clinical diagnosis. Obviously, when you do this procedure, it's a very lengthy procedure. It's very invasive, and there's a long recovery time, and you don't get better. Very often you get depressed because you think that you're supposed to be getting better and you're not getting better. Decrease in patients returning to work. A workman comp study, what they found is a lot of patients after the fusion, they just physically cannot go back to work. Fewer than 10% of all patients have the surgery actually say they have no pain. We talked about that already. So these are the trends. This is what happened with him. What do we do? Here's the one important fact about all this is we treat the disc. I'm not going to talk about all these, but we treat the disc. And our ability to treat the disc solves the problems with these patients. He came in to see us after he had the laminectomy, after he had the fusion, did not get any better, after he took the injections, did not get any better, and was taking the narcotics. We talked about that. He had a spondylolisthesis. Spondylolisthesis is where the vertebrae shift on top of the vertebrae, on top of the disc. He had a bulging disc and he had stenosis. He had 3 of the 5 causes of sciatica. The sciatica is the pain that goes down the leg. It starts up here, comes all the way down the leg. And these are the conditions that will cause sciatica. So we had these conditions. So what do? We treat those conditions. We have the ability to treat the spondylolisthesis. We have the ability to get those vertebrae to find a better position or take the stress off the disc, which is really where the pain is. Same thing with the bulging disc. We have the ability to take the pressure off the disc, allowing that bulging disc to move back in, also allowing the herniated disc to move back in. Same thing with stenosis. We have the ability to solve those problems because those problems are disc related. So, when he came in to see us, his back pain was a 9. On a scale of 1 to 10, or 0 to 10, 0 I have no pain, 10 is I have severe pain, he was a 9. That's about as high as you can get. His Oswestry Disability Index was a 44. His Oswestry Disability Index is a 10-question questionnaire that quantifies how disabled you are as a result of your back pain. How severe is the back pain affecting your life? That's your disability. So he was 44% disabled. He was severely disabled. And what we know, and we've talked about this 100 times, is patients that are 40 and above are candidates for surgery. You already have one surgery. 8% of all fusions end up with a second fusion. And the second fusion, the outcomes are even worse. So it's a slippery slope. Once you start down that slope, it can be a very, very, very slippery slope. So we knew he had a high level of pain. He was severely disabled as a result of his back problem. Post-fusion, post-laminectomy, post-injections, taking narcotics, and he was in a lot of pain. After the therapy, 23 treatments, which isn't a lot, quite frankly. Back pain was a 0, sciatica was a 0, and his Oswestry disability index was a 10. So what does that mean? Pain went away and his disability went away. They say 10 and below is asymptomatic. Just a little bit of achiness once in a while, but no back pain. And what do we know from the earlier studies? That 10% of all fusions actually get out of pain, where we were able to get him out of pain. Okay, we were able to save him from another fusion, able to get him down to where he was able to live his life again. Our goal is to take you from pain and suffering to doing what you love to do for a lifetime. Now here's the key. We talked about the fusion, and we talked about the degeneration and the stenosis that takes place after you fuse it because you've loaded the discs. So how does our treatment get them better when none others have? Because we affect the disc. It's the only therapy like this, and we have the ability to solve the problem even in the cases of the worst possible back problem you can have. If you're post-fusion and you have failed, it's a slippery, slippery slope. We talked about the increased use of opioids, very common, increased depression, less ability to work, less ability to live, quite frankly. And if you're suffering like that, it really takes all the joy out of everything. So what do? We take the pressure off the disc. We affect the disc. That's why sometimes surgery is not the best option. I know we're only in Illinois, and a lot of people watch this from all over the whole country, but we affect the disc. We affect the disc in ways nobody else can. This is what it looks like. One vertebrae on top of the other. Here's the disc in between. This patient had a herniated disc. Okay, when I say we affect the disc, we put them through our treatment, and after a certain amount of treatments, we did another MRI. You can see the disc is getting better, and by the end, the herniated disc was completely gone. So we know we get healing in the disc. It's happening. That's why patients that have had the fusion surgery and didn't get better and or got worse, which is very often the case, they get better because we affect the disc. We don't affect the area where the fusion is. We affect the area above and below, and we stabilize it. And you physically start to get better. This is what we do. We stabilize the disc. Functional disc stabilization. We get healing in the disc. We reactivate the muscles. I know this one was a little bit longer today, but this is an important one. And I haven't done one for a week because I was out of town. So, if you like our information, I want you to like our page, but I also want you to share this information, because I tell you, there's a lot of people suffering with back pain they think is never going to go away, and or they're suffering post-fusion and the pain didn't go away. We can help them. It's not a miracle. It takes time and it's effort, but it's doable. We can help you by taking pressure off the disc. So share this information and like this information. Also, I want you to subscribe to our YouTube channel. I want you to follow us on Instagram and follow us on Twitter. We have all our videos categorized on our YouTube channel. Sometimes they're hard to find on the website and or on Facebook, but if you go to our YouTube channel, you can watch them all. And we've got a lot of videos. We talk about exercises, we talk about tips, we talk about stretches. Our goal is to help you get your life back. That is our stated goal. Our mission is to eliminate back pain from the planet, and we're going to get it. With your help, we're going to get it. So, today's Monday. I'm going to be done, and we'll see you tomorrow with a tip. Right, Cody? Tomorrow's Tip Tuesday. So, if you guys have any questions, I want you to put your questions in the comment section, and we'll get to your questions either later today, although it's getting late, or tomorrow. So that's it. I'm done. I'm signing out. Thank you very much. Be careful.